Okay. Hi everybody, Dr. Marshall Bronstein here. This is Milady's, my assistant, and one of the most important things there is in understanding low back pain is the correlation between certain muscle groups and how the low back functions. The main muscle group I always look at is the hamstrings muscle, which is usually very tight in chronic low back cases. I'll show you how to check that in a second. The second important group that we check in low back cases is the external hip rotators, the gluteuses and the piriformis. And Milady's going to just show you. Milady, we put one leg on top of the other. I call this the figure four, and Milady's a classic piriformis contracture. You could see how the knee points up. Ultimately, you want to have the knee down here. So we have her do a very simple stretch where she puts the arms forward. She uses this as a weight. She puts the head forward to take the pressure off of the neck, and she breathes, 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 gets oxygen in. What this does is it's a direct stretch right to the piriformis. You can't miss it. If the patient doesn't feel it in the left, or if you don't feel it in the left hip, you're not doing it correctly. But this is a very simple exercise. It should be done about 3 times a day on each side, and you should hold it for about 2 minutes. Our stretches I teach to sustain the position. So Milady is doing a great job. She's breathing. I could hear her. And we're going to cut her short. Again, you want to hold it for 2 minutes, and you don't want to do it to a point where it's angry or uncomfortable. Milady, will you switch, please? Good. You could see her grimace a little bit, but it's a good pain, right, Milady? So again, you want to bring it to a point where it's not uncomfortable, where you could hold it. And think of something else, Miladies. Think of the beach, or think of salsa dancing. Go ahead, just one more second. Show the people. I know she feels it right on her right hip. Okay, from here we're going to do a stretch for the hamstrings. Milady, please scoot backwards. Take your shoes off. Good. That's fine. And in her case, the hamstrings are tight, but they're not to a point that's critical. Ultimately, we want to bring it right to 12 o'clock. So in her case, I would be working the external hip rotators more than the hamstrings. She's groaning a little bit. She's a bit of a baby at times. But here too, the hamstring is not terrible, but you could see that the hip rotators are very tight. This knee should be about 2 to 3 inches from the table. So we'll be working on that. Thanks for joining us today, and we'll check in with you tomorrow.